ECC Timeout talks are brought to you by State Farm. The James Von If Agency is here for the ECC family during these unexpected times. For more information and to get a quote, visit www.vonifinsurance.com.
Hello, everyone. Welcome to East Coast Conference Timeout Talks. My name is Bob Dranoff. I'm the commissioner of the East Coast Conference. Happy to have you with us today, and really happy to introduce to you Dr. Hallie Zwibel from New York Institute of Technology. Dr. Zwibel specializes in family practice, but he has a few different official titles at NYIT. He's the team physician for New York Tech Athletics. He is the director of the Center for Sports Medicine there. And he is one of the institution's experts, maybe one of the nation's experts in esports medicine. Welcome, Dr. Zwibel. We're really happy you're with us.
Oh, thank you for inviting me. I'm happy to be here.
We're going to focus on your work in esports medicine today, but I wanted to make sure, since we do have an expert on both family and sports medicine, we wanted to try to get some of your thoughts about where we are right now, especially, I guess, in the New York metropolitan Long Island area, in how we're dealing with COVID-19. And maybe you could give some of your thoughts about how it's impacting us, and what are your thoughts as we're moving forward?
That's an excellent question. Obviously, everyone's aware of COVID-19 by now and the impact it's had not just on our area, but the nation and the world. The good news is that in our area, in downstate New York, Long Island, New York City, and the rest of New York State, we are on the decline in terms of the number of new infections that are happening, the number of hospitalizations, and the number of deaths that have occurred from COVID. So all that is positive in that we're heading in the right direction. The downside is that these numbers are declining slowly. So it seems like we still might have a while ahead of us. There also is some good news in that there seems to be some new medications that are showing to be effective. There are work going on a number of vaccines, and some look very promising. But to tell you the truth, there's still a lot of unknowns, and it's really, it seems like it's been a long time personally, and I'm sure to everyone else, but I think we still have a while to go before we can really see the light at the end of the tunnel here.
Yeah, there's been a lot of discussion in obviously in recent days about the reopening of New York, and where that's going. And our governor and the state have a plan. The nation has a plan. The NCAA just sent out some information, some advice about the reopening, resocialization of sports on campuses. And like you said, there's so much up in the air. In your mind, if you were specifically to talk about, especially as the team doctor at New York Tech, your thoughts about what would have to be in place in your mind for not just New York Tech, but any college athletic program to restart? What are some of the basic things that you think need to be there?
Well, we need to reimagine what a college campus and what an athletics program looks like. Before, we wouldn't think twice about having, 1,000, 2,000, 3,000 people together, or a locker room crammed full of people. Knowing what we know now, and with the expectation that the disease will still be around in the fall and maybe the spring, we need to have some common sense policies that we can allow sports and other activities take place while still having safe conditions. So what does this look like? Well, the NCAA has put some guidelines out there, some propositions that seem pretty reasonable in a phased-in approach, where we start with some smaller practices, things like that, in smaller groups, more advanced cleaning, temperature checks or other symptom checks when people come onto campus, and better policies in terms of identifying who might be at higher risk, antibody testing and understanding the immunity. If there is immunity, at what level the immunity exists in the given population. So I think there's a lot that we can do. And I think the devil is going to be in the details, but we have a lot of work to do ahead of us. The good news is that we have people who are really qualified and have a good understanding of both health and athletics and public health, who are working hard to make this happen.
Well, that's a good point. I think that you come at this from the perspective of a physician, of someone that is a professor in the School of Medicine at NYIT, someone that is involved on a daily basis with student athletes when there's student athletes on campus.
Yeah.
But you also, I would imagine, come at this as the perspective of a father and a husband, and from and you work with families and family health. I guess the last thing I would just ask you on this topic is if you were advising parents and students as they start getting ready to come back, just some of the things that are important that you would make sure that they're thinking about also.
That's an excellent question. So there is a lot to consider. And we talk about these broad things like general policies for school or for athletics, but a lot of it comes down to individual decisions, individual practices. So at an individual level, making sure that that individual athlete is practicing good hygiene, is maintaining social distance. It comes down to making sure that you're following the guidelines in place, but also that you speak with your healthcare team at the university so they're aware of any other conditions that you have that might place you at additional risk. We know that most people who get this ultimately wind up being fine, especially younger individuals might have some mild symptoms and it goes away without a problem. But even some people who are athletes and in great shape have some conditions that might put them at greater risk than someone in the general population. So for those players, we really need to be more careful. And it's always a good idea to have a dialogue in place between your athletic trainers, your team physician, coaches, and everyone else you work with so that we can have you be as safe as possible and we can put things in place to make sure that you can play safely.
I think those are excellent points. You said right at the top that this is in truth a different world. When we do come back with athletics, when we do come back to campus with classes, it's a different plan. And part of that, I think you just said, is that there has to be responsibility. There's a lot of responsibility that goes around, and it's not just on the institution, it's on the student and the student athlete also to be smart, to do their part also. That's really well said. Let's change gears. You and I have had the chance to talk about esports over the last couple of years. New York Institute of Technology is a charter member of our esports group in the ECC. We're one of the first athletic conferences to offer esports as a conference sport. New York Institute of Technology and their coach Eliezer Duran, who is my go-to guy for everything esports. But they've been a really successful program, and I wanted you to maybe talk a little bit about some of the esports research projects that you've worked on and you continue to work on.
First of all, I agree with you. Duran is phenomenal. If any of you out there have met Duran, our esports coach, an amazing guy who really put the foundation of everything together for having a team and a strong team at NYIT. In the Center for Esports Medicine, our role is to really figure out what the health and wellness conditions associated with esports look like. When we talk about traditional athletics, there's so much sports science involved. Everything from the drills you do to the practice scheduling to the food and liquids you put in your body. Esports doesn't really have that in place. So what we're trying to do is establish what makes a strong esport athlete, what risks are inherent in esports. And just like we can't retrofit, football risk to a soccer risk to a tennis risk, there's an individual profile we need to determine for esport athletes, and we've really done a lot of work in shaping that out.
What was it about? I guess part of the reason it piqued your interest was because it was happening on campus, but and the fact is that I guess there isn't a lot of research out there from what you've found. So a lot of things that you've been doing, I would imagine, are kind of groundbreaking. Where do you see this world of competitive gaming going? It's obviously has gone through the roof internationally, but the growth has been pretty strong on college campuses also.
Yeah, it's a multi-billion-dollar industry worldwide. Some of the professional events get more viewers than the Super Bowl or World Series. And I think it's 200 plus college campuses now have esports teams, if I remember correctly. So it's growing. Where I'd say it is in terms of health is the Wild West. A lot of it is just anecdotal. Someone thinks that something helps, like a lucky sock in baseball, if you remember Wade Boggs or something like that. But really, it's, this worked for me, and that's the gold standard out there. Whereas in other traditional sports, we do the science and find out that this program makes you the best possible athlete, right? So we want to use those science-based protocols to figure out at what point in gaming does your reaction time decline? How many hours is it safe to practice that time before you're not getting any benefit? What makes you perform at a higher level when you're in a competition, right? Those are the things that sports science brings to the table, and that's what we're trying to figure out right now.
So, as you've explored this world so far from a medical perspective, I'm wondering what so far, you talked about traditional sports and what we see as the physical, emotional, social value of participation, whether you're a young person or post-college. What do you see as the value of esports then for young people?
I think there's a few things that make esports attractive and valuable to young people. Just like traditional sports, or many traditional sports at least, most esports games are team-based. So you get that interplayer interaction. You have to work together to succeed. So that makes you have responsibility. It makes you show hard work. You have to understand what one another are thinking. And that really translates to the real world, right? Yeah, we all work in teams, whether we're in business or medicine. You have to succeed as a team, right? Or fail individually. So it really shapes that. There's a lot of practice involved. There's a lot of commitment. And that's an important thing for any young person or college student to really develop, and it builds character within them. So there's some advantages there. We also know that from a cognitive perspective, video games can enhance some perspective, especially in terms of multi-object tracking. So it does have a lot of benefits. It's not all good for you, and there are things that do have downsides compared to traditional sports. But
that was what I wanted to ask you. So the reverse side of that is, as you look on it as especially, I guess, from, if you take off your sports medicine hat a minute, but from your family health perspective, there's been a lot written about the dangers of esports also. Anything that that you see that are warning signs that you would want to make sure a parent of a young child who's getting more involved should be aware of?
Yeah. Well, inherent in esports at this time is that you're sedentary, meaning you're sitting or not moving for a decent period of time. We know that has negative effects on the body, right? We're all going to be sedentary for some period of time, but sitting for hours on end does not do us any benefit. In fact, it places us at risk for some things down the road, right? But immediately it increases your risk of pain throughout the body, such as back pain or neck pain, and can place you at risk in terms of your ability to compete, right? So we know people who are moving around and are exercising have better emotional control. They're in a better mood. They're actually thinking better, and they have better composition so that they're getting more sustained energy throughout the day.
As we were getting involved in esports on a college level, obviously you could imagine that for those at schools that really, there are people that don't see this as fitting into an athletic program. And so sometimes that discussion is not easy for some of the reasons you said. It's not a traditional sport. The whole sedentary aspect of it. It's very difficult to control the hours of practice in a thing like esports, because you literally could do it for 24 hours if you chose to. But I think what we found is, from an emotional perspective, that being part of a team for individuals that maybe haven't done that in the past or don't have that opportunity, and also to build the social part, to be part of something to represent your institution, has a lot of value in it also. So I guess it's like anything else. Too much of something is not usually that great for us. And so it comes down to individual responsibility and people that are organizing these activities on your campus that are making sure that that the students that are involved are really the students first and esports players second. So we could support them that way. But I think that in my time involved in athletics, I've never seen the growth of something that fast as I do esports, and I think schools just see it as a real bonus and opportunity to get more people involved.
Yeah, and I think you're right about that. I mean, as you know, working with the esports community, they're incredibly passionate, right? They love what they're doing. So that enthusiasm is really contagious. It makes everyone who works with them really want to help and take a closer look at it and find out what is exactly that's going on. How do the games work? What does competitions look like? It draws in a lot of spectators and fans. So it's something exciting. It's not everyone's cup of tea, obviously, but there's such a strong following out there, and that passion is just so evident through their play.
I agree, and I'll tell you, I don't see it taking a downturn. If anything, I think it's going to grow, and there'll be more involvement, and schools will be will put more resources into it as we move forward. So I think you'll have plenty of new opportunities to do research for years to come. I do want to thank Dr. Hallie Zwibel for coming on with us today on ECC Timeout Talks. This has been very informative. I admire the work that you do at New York Tech, and you're a wonderful guy. I think they're lucky to have you involved in their program, and we're lucky that you came on with us today. So thank you very much. I hope you and your family stay safe, and I look forward to seeing you in the fall.
Yeah, thank you so much. It's a pleasure always.
Thank you.